Hello and welcome to another episode of Q&A with Dr. Karishma. In our second wave of COVID, we seem to be having a new infection called mucormycosis, which is on the rise. I'm here today to talk to you on that. This is a rare fungal infection, but it is seen commonly in uncontrolled diabetics. Because of the fact that they have a high sugar level, their immunity is low and they are predisposed to such infections. It may not just be mucor, it can also be some other types of fungal infections. These fungal infections are what we call opportunistic infections. They are waiting for the opportunity for your immunity to be reduced so that they can take over. So it's typically seen in uncontrolled diabetics who have gotten COVID, where their sugars have gone beyond control, particularly those people who have been on long-term steroids to help them get better with COVID. Also, in addition, if they have been given any immunomodulators, for example, tocilizumab, these patients are more prone to develop that infection. Now, the idea of bringing out this information into the public is so that patients are more aware, and if there are any symptoms that they experience, they can come forward and seek help. We do not want to make this information create panic in random public. So I have received a lot of WhatsApps and phone calls asking me about whether any normal individual will get this. And there are WhatsApp messages doing the rounds that even people who don't have COVID can get mucormycosis through their masks. This is not true. Please do not circulate such messages. Do not create more and more panic. The reason why we are making patients aware of mucormycosis is so that these particular subset of patients who are more predisposed to develop it can seek help at an early stage. Why? Is because if it is treated early, you or the patient rather can be helped in time, and radical treatments may not be required. If it is missed or goes undiagnosed for a long time because the patient is not aware that he needs to seek out help, that is when the problem arises. So what are the signs or the symptoms that the patient may experience? There may be a stuffy nose, there may be crusting of the nose because there's actually a bloody or a black tinged discharge, and that causes stuffiness of the nose. So even if it's not coming out, you may experience stuffiness of the nose. Who is the you? The post-COVID diabetic or uncontrolled diabetic who has been given long-term steroids or immunomodulators, not random people who have not gotten COVID. No, they are not going to be affected by this. Secondly, you may experience one-sided facial pain, you may experience dental pain, you may experience reduction in the vision. So if there are any post-COVID patients who are experiencing these symptoms, then they need to visit their ophthalmologist or ENT surgeon or their treating COVID physician at an early stage so that there can be timely intervention done. Okay. How can you reach out to them? Maybe your swab is still positive, maybe you are experiencing this and you don't want to step out. The entire medical fraternity is available right now for teleconsultations. You can reach out to anybody through teleconsultation, whether it's your ophthalmologist, whether it's your COVID physician, whether it's your normal general physician. Everyone is available for teleconsultation. So if you are hesitant to step out of the house, make use of the fact that we are currently available for teleconsultations at the drop of a hat. I hope this video was helpful and has allayed your fears. You can email me any more inquiries that you have on jehaneyeclinic@gmail.com. Stay safe, stay home. Thank you.